Endometriosis and its complications is wisely explained by Dr. Vidyalakshmi. Dr. Vidyalakshmi ma'am. Here I want to thank you each and everyone, those who want to learn through me. The reason is that the main thing related with endometriosis, the constitutional approach as well as the asthmatic approach in homeopathy. The basic theme, what I want to mention here, the reason is that this is the true pathway to attain success without any suppression and without any masking the layer. That is the main theme here. I want to contribute to you all to learn the wonderful system of medicine gifted by Dr. Hahnemann, our founder. Today my topics regarding the introduction to endometriosis, emotional background, mathematics background, cases from my clinical desk, where I have given the clinical desk cases like endometriosis, endometrial cyst, adenomyosis. For the knowledge purpose, I have enlightened the candidiasis, vaginal candidiasis case, because the reason is that vaginal candidiasis, this is also a root cause of infection which in later stages can be changed into PID as well as endometriosis. That is the main reason for me to select that particular case, and also you can understand in my later period why I have chosen that vaginal candidiasis case. As ma'am explained beautifully regarding the endometriosis etiology and its causes, I want to mention only in a short term, because endometriosis is a disease which causes severe pain, irregular bleeding, dysmenorrhea and infertility. Sometimes untreated endometriosis with the adhesions leads to cancer or tumor. Now, I want to mention the emotional background in endometriosis. This is the main theme in homeopathy. Can anyone try? What could be the reason? The emotional background through homeopathy. What could be the reason for endometriosis other than etiology?
Suppression of emotions and yet.
In what form? Try something. What could be the reason for suppression of emotions, especially in women?
Family situations, not letting out the emotions freely.
The dominant history.
Yeah.
That is the actual thing, that especially with the opposite gender domination. Regarding that could be before marriage, it could be connected with siblings, brother or husband. After marriage, it can be connected with in-laws as well as what only the domination can't be the reason for the endometriosis in women or any other complications in female reproductive part. Because the reason is that the woman never should feel that I am hopeless. What is the purpose of living in this world? The meaning of making her to feel that what is the purpose of her life. That is the main reason for her to develop the endometriosis or any other complications related to the female reproductive part. Now, regarding homeopathy, I want to show the Miasmatic background. Again, I want to ask you all, what is the reason for giving importance to the miasmatic background, whatever could be the disease? Why we have to analyze what is the stage of miasm, why we have to find out the predominant miasm in a particular woman who is suffering with endometriosis or cyst.
I think psychosyphilitic predominantly.
What I am asking is that what is the reason for finding the stage of miasm?
Probably to find out the correct remedy which will also cover the psychotic part and the syphilitic part, so that we remove the disease layer by layer.
That is true. Other than that, the main theme is that we have to know the potency selection. The stage of miasm is very important in potency selection because, for example, a lady with severe bleeding, we never try to prescribe 200 or 1 though there is an emotional cause. Because the reason is that we always know, being a homeopath, 200 and 1 will have the aggravation of the symptoms, then only there will be amelioration. By considering this, the stage of miasm is very important, especially for the potency, as well as the source of the remedy. Because what is the connection of source of the remedy? Why we need the miasmatic background to select the source of the remedy? Though it can be a symptom.
The duration and the deep acting remedies, we'll give it in a deeper cycle.
Yes, sir. Exactly. That is the main reason, especially when there is a psychotic phase or syphilitic phase, even with the acute exacerbation of the disease or chronic stage of the disease, we should not prescribe first prescription as the mineral remedy. Any idea what is the reason for not to prescribe mineral remedy?
That might cause aggravation.
Yeah, because this is a deep acting remedy. That is the main reason. So, basically in homeopathy, knowing only the diagnosis or the disease stage is not only important, the miasmatic background and the emotional background is very important to select the potency as well as to select the symptom based on the source of the medicine prepared. So, please note these things because this is very important part in homeopathy. I have elaborated each and every stage and female parts according to the scora, psychosis, syphilis and tuberculosis. Since it is the font is very minimal, I will explain so that you can notice it. The main theme here is with scora, whatever could be ovary or uterus or any layer in female reproductive part, it will be functional. So, can you think what if it is only functional, what would be the disturbance? As man already told that some are asymptomatic and some are not even showing any symptoms, while finding the investigations for the cause for infertility only can able to find it, what is the reason for the infertility. So this is the main theme. That's why I said miasmatic background ruling out is very important in homeopathy because scora always have only functional disturbance where there will be unusual reason of amenorrhea. All the female parts will be very much normal without any symptoms. Only symptoms we can see is irregular cycle. The flow sometimes will be very scanty, sometimes intermittent bleeding will be seen. But the pain will be very sharp. This is the characteristic symptom of psoriatic background whenever a woman is suffering with uterus disorders. Another thing, the discharge will be very bland and very scanty. Even the discharge can be easily removed and washed up and there also not be seen in any stinking smell or any putrid smell. That is also the characteristic symptom seen in SORA. So what could be the complications in soric stage? The main thing is that infertility because of long-standing problem, thinking that this woman nature itself like that, because especially in the families where there is older ladies, they will tell that in my age also I have like that only. You no need to worry about that 1 or 2 cycle getting skipped or 1 or 2 months getting delayed or 1 or 2 months with heavy flow or scanty flow, nothing to worry. This is the statement given by the old ladies, especially among the families. So that's why infertility will be the main complication in the soric stage, though there is no structural deformities, because the long-standing irregular cycle leads to the hormonal disturbance in the woman. That is the main reason for the infertility in the soric stage. In psychotic stage, as we all know, psychosis is commonly a proliferative stage and the multiplication stage. What all could be? It can be cells, it can be layers, it can be serosal layers, mucosal layers, what all could be. There will be because of proliferation, there will be inflammation as well as cystic formation. As ma'am explained already, related with ovarian cyst, endometrial cyst, uterine fibroids, endometrial thickening, adenomyosis, everything comes under psychosis. Here, the flow of the menses in such a way that it will be very profuse, acrid, excoriating the linen, and almost the stinking smell will be like as a fish brain. This is the typical symptom we already know in medorinum. So the similar pattern can be seen in all psychotic discharges. So here I want to mention this particular thing is that whenever you are seeing a woman with fish brain smell discharge, you should not select medorinum, because selecting of no sorts in any stage of miasm, especially in the acute stages, is also not a wise choice, because being a homeopath, we should be very responsible in treating and curing the patient rather than suppressing the patient. So this is very important, as we all know that homeopathy also have side effects as well as complications when it is not selected properly, especially specific remedies. Please don't go for specific remedies at any stage of the disease or any stage of the people, because treating with specifics is the worst way of suppression in homeopathy. So the holistic approach with selecting a symptom, if it is a chronic case, select a constitutional symptom. If it is an acute case, select according to the totality of the symptoms. Here we have the responsibility of framing the totality by removing the common symptoms of miasms. That's why I give more importance to the miasmatic background in homeopathy, because all the common symptoms of miasms should not be taken into account whenever you are treating the acute stages of any disease, not only for endometriosis. So, coming to the point, here the pain will be spasmodic and colic. The reason is that the muscle involvement will be there. Because of the inflammatory stage, aggressions will start. So, the pain experienced by the endometriosis woman will be more colic and more spasmodic. The discharge will be offensive, putrid, difficult to wash off, and the patient regarding the syphilitic stage will be, as we all know that syphilitic stage comes under destruction as well as degeneration. So, the final stage of endometriosis or the final stage of adenomyosis, or sometimes it can be complicated with the cancer or tumor. This is the syphilitic stage of the endometriosis woman, where you can see the flow will be excess. Even sometimes I have the patient, one of the patient, this is my third case, I will show you in the later time. That lady had the flow of menses almost 30 days. So such a stage can be seen, the long lasting flow can be seen in syphilitic stage, but there is a difference between syphilitic as well as tubercular, because tubercular miasm holds the long lasting exhaustive period rather than syphilitic. The difference between these is that there will be a absence of flow in between in syphilitic, but that can't be seen in tubercular. Tubercular almost till the second cycle they will have the flow. In between 1 or 2 days or 1 or 2 weeks will be the flow minimal, or the flow will reduce, or the flow will be absent. Here, since all the degeneration changes happen inside the uterus and outside the uterus as well as ovaries, the pain experienced by the woman will be back pain, because the uterus started getting adhered to the pelvic bone. So the lumbago is the characteristic symptom of the syphilitic stage of endometriosis. Again, the flow of the menses will be very dark red, very dark flow mixed with large clots with offensive putrid odor, difficult to wash off. In tubercular miasm, as I already told you, the thing is that it will be very heavy flow and the exhaustive, long-lasting flow, which almost lead the patient to the anemic stage. They can't even lift up. Their well-being and their physical as well as mental well-being completely disturbed, both in syphilitic as well as the tubercular stage. Here, what is the other than menstrual symptoms, we have to know certain symptoms which can be make us to realize what is the stage of the miasm in the particular woman. Regarding considering that, the face in psoriatic stage will be very dry, scaly, and the itchy pimples started appearing, especially teenagers and ovulation period as well as the follicular stage period of the woman. In psychosis stage, the face, as we all know that psychosis always will be accumulation and proliferation. So, of course, in the face we can see the dropsical, edematous. This is the characteristic symptom in the face, can be seen in psychosis. In syphilis, the acne will be very big and very much painful. Even it shows like as a sebaceous, the hard pimples, very much painful. Sometimes pus also will come. This can be seen in syphilitic stage in the face of endometriosis or any type of disorders related and connected with the female reproductive parts. In tubercular miasm, again the face will be very bloated. There is a difference between the bloating of face in psychosis and tubercular. Can anyone try? Of course, psychosis and tubercular both are having dropsical bloated face. What is the difference? That's why I have differentiated with the words. Psychosis is dropsical, tuberculosis is bloated. As psychosis is a accumulative miasm and accumulation proliferation, it will be the collection of water. But in tubercular phase, it will be bloated. The reason is that the patient becomes extremely anemic. That is the indication for the bloated phase in the tubercular stage of endometriosis. Again, the complications connected here is psora with infertility, and the psychotic stage, as we already know that accumulation, once again the hormonal imbalance happens, which will be the most challenging thing. That's why even in ovary, we have to differentiate between PCOD and PCOS, because simple ovarian cyst is very easy to treat. But ovarian follicle is very risk to treat. The reason is that abnormal hormonal imbalance, which is very much deep-seated disorder, which we should be very careful in selecting the remedy, where the only constitutional approach can do wonders in that particular stage. So no need to worry about that. Homeopathy can't do anything here. Homeopathy is a wonderful system where the hopeless cases meet up with hopeful cases. Especially in syphilitic stages, as there is destruction and degeneration of any part in the female reproductive part, where the leads to main thing with ovum. There will be failure of release of ovum during the ovulation stage, as well as bursting of corpus luteum in the menstrual mucus. That's why such women facing huge clots because of the rupture of endometrial layer along with the menses flow. That is the main reason for them to get such a profuse flow with huge clots. In tubercular miasm, it will be artificial profuse exhaust bleeding, mainly leads to all the deficiency disorders as well as anemia. So, general manifestation regarding the miasmatic background is that in psoriatic stages there will be 4 A's: atrophy, anorexia, ataxia and anemia. This is the 4 A's you have to remember regarding the general manifestation of any endometriosis or any complications related with female reproductive parts. Here again, because of the anemic stages and due to anorexia is nothing but absence of eating properly, always feeling the nausea sensation. So this leads the woman to develop the severe immunity disorders. Immunity system will become very low and there will be the deficiency of minerals as well as vitamins. So this is the stage. Psoriatic should be very careful. We all know that psychosis should be very careful rather than psoriatic. But psoriatic is asymptomatic, but psychosis asymptomatic only in the investigation part. For example, if you go for investigation in early stages of psychosis, the patient will show the abnormalities in the abdomen scan, but there won't be any changes in the blood investigations. Even all the blood parameters will be normal. So with that, you should not think that that particular woman is safer. So that's why Hahnemann has explained beautifully in theory of chronic diseases the how to handle each and every stage of miasm, because the challenging part in homeopathy, when you are handling homeopathic cases with holistic and constitutional approach, you have to be very careful in understanding the personality judging as well as understanding the investigations part as well as everything in a holistic way, like physiological reactions, pathological reactions, reports, everything stands before selecting a synonym. In psychosis, the general manifestations will be like melanin pigments excess deposition in the face. We will say in sepia, we will tell no saddle-like nose, the dark pigmentation will be seen. This shows that the accumulation and the proliferation stage leads to disturbance in the pituitary also. The gonadotropin hormones get disturbed, as Dr. Vijayalakshmi ma'am explained beautifully. The pituitary gland gets disturbed because of the hormonal imbalance. So the hyperpigmentation is seen in the psychotic stage. In syphilitic stage, before going to syphilis, there is another key symptom in psychosis is that the physical and mental restlessness because of the prolonged flow and because of the excess colic pain, faced during every menstrual misses. Because of that, the patient becomes physically restless, mentally restless. In syphilitic state, there will be 3 Ds: destruction, dystrophy, deficiency. Because of that, deformities will be seen, as well as the organs become very tangible and very fragile. That's why this stage is very irreversible in any system of medicine. In tubercular phase, again there will be depression, dystrophy and hemorrhage. Excess hemorrhage is the key feature of tubercular rather than syphilitic mechanism. The overall digestion will be in spheric phase. They can't even assimilate anything. Whatever they eat, everything will go as a waste. That's why all the spheric individuals, irrespective of any diseases, they will be very lean and emaciated. There is a difference between in spheric as well as syphilitic for the lean and emaciation. Because of the poor assimilation, sphera patients will be very lean and emaciated. But in syphilis, it happens because of the loss of all minerals and vitamins along with the destruction of the particular pathology and particular part leads to extreme stage of fatigue and malaise. That's why all the type of cancers and last stage of tumors comes under syphilis. In tubercular stage, they craves the things which can't able to digest it. For example, the perverted craving will be seen in tubercular. The reason, can anyone tell what is the reason for perverted craving in tubercular miasm? Because of excess anemia. Excess anemia is the main reason for perverted craving. Whatever they can't able to digest it, they prefer to eat it. Here the interesting point start. Clinical cases from my desk. Here I have given 4 cases. Endometriotic cyst, endometrial thickening with PCOD, adenomyosis and vaginal candidiasis. Vaginal candidiasis, as I have mentioned here, the reason is that baby is 6 months old. That is the main reason for me to select this case, because this is my case which is connected to my heart, because I feel proud as a doctor, as a homeopath, to save a baby within 4 months, that too with a single dose. This is again a most complicated case and most interesting case, because this case comes under the complex dissimilar phenomenon, where it is more challenging for a homeopath to treat, because that lady came to me only to treat her epilepsy, but she has such complications with epileptic disorders are almost around 10 years. Dysmenorrhea. In fact, the wonderful thing is that she didn't even mention that she is having chocolate cyst in her ovary. She didn't even bring the uterus report. She simply said that I am having dysmenorrhea, I will have painful menses, that's all. But the flow will be normal. This is a one-way statement told by her. After 4 months, she took on her own, because she knows that she has the problem. Because of that, she took the scan report which showed free of cyst in ovary. So this is the beauty of homeopathy. Even when the patient is missing to tell, you can do wonders. So this case mainly means sleep always disturbed almost 10 to 15 years because of the aura. She developed aura only in the night time, especially during sleep, basically with the symptoms of twitching of fingers or twitching of legs. That is the partial seizures she always experienced. She was under the treatment of allopathy support also with psychosomatic medicines as well as epileptic medicines because she was a patient of psychosomatic disorders almost more than 15 years. She was having the symptom of thermal chilling, thirstness. The sweat will be very dry and very almost wet. If she is doing some excess work, there will be very much minimal sweat, that too only in face or only in her neck. She always craves for the sour foods and vegetables. She never liked non-veg. Even I can say she is a vegan. But she developed it only in the later stages. Once she was a non-vegetarian eater, she is a foodie. But in recent times, she became as a vegan because she feels nausea whenever she tries to eat non-veg. That is the main reason of her to become as a vegan. Her appetite will be ravenous. The reason is that only the small quantity she can eat at a time. That's why she often tries to eat frequently. She fills her stomach by eating frequently the small amount. Her urination is very normal, but she always faces the sensation of something is pressurizing in the bladder. This is also the complication of the endometriosis, where ma'am explained beautifully. There will be common symptom of constipation as well as the urinary difficulty because of the endometriosis symptoms. She has the problem of passing constipation also. This is also again the complication of the endometriosis rather than thinking about that this is the peculiarity of the individual. But still I have mentioned here, the reason is that you have to rule out the common symptoms when you are framing the totality of symptoms. That's why I have mentioned the symptoms. Her puberty age is 13 years. Very regular cycle lasting 5 days. In the recent years, once she started developing the endometrial chocolate cyst, especially in the left side ovary, she developed the flare pattern in the first 2 days with the sprouting. There won't be the regular flow. At least 1 or 2 drop will come in first and second day. Her regular flow starts from the 3rd day, which lasts almost for 5 days or 6 days. The remaining 3 to 4 days will be the profuse flow will be there. Along with that, she experiences the pain as well as she feels nausea because of the excess flow and because of disturbed sleep. Already she is having oral epilepsy problem. Along with that, the menses also triggers the sleep, which make her to feel nausea because of the flow, as well as this comes under anorexia comes under which mechanism?
Sorry.
Yeah. This is the mind symptoms related to her. The main reason, as I already told you, the ailments from the domination which started from her mother, not father. This is the difference here. The domination in the sense, she is also a lovely mother. This patient also get a lovely mother. But the reason here I want to mention here is that her mother always wishes her daughter to live according to her wish. The particular woman should not have any dream or any wish, even what she has to wear, what she has to eat, what she has to study, when to get married, where to live, how to live. Even after she is having daughter now, till today her mother is dominating her. According to her wish only, she has to live. This problem continued with her after the marriage also, through father-in-law. Again, mother-in-law is good, father-in-law is bad. The gender changes, but the domination continues. So here, even this father-in-law also, not an arrogant man, the same pattern like a mother, he always wants to give instructions for each and everything. No privacy in between her and her husband. Even when she wants to go out, her father-in-law should give permission. This is the nature. So here we can clearly understand that domination is not the problem. Living according to the other's wish is the problem. She never lived one day with her own wish. Though her husband is such a gentleman with a humble nature who is supporting till today. But still she is facing lot of issues because of the reason is that at least for one day within her death she always tells the same statement to me, at least one day I have to live my life without anyone's wishes, without anyone's instructions. So this is the main longing for her, which helped me to find out the exact symptom. Her graduation is CA. She worked for almost 2 to 3 years. Because of this endometriosis problem, she struggled with getting cancer. Because of that, she dropped her job and started getting more important to the getting cancer and taking care of the baby. That baby is also a cesarean section because of the lot of complications in the uterus as well as in the ovary. She is a slow thinker. What could be the reason for slow thinking? Though she is a graduated CA, what made her to be a slow thinker? Yeah, that's true. She can't able to live even for a single moment or single day. That is the main reason for slow thinking, as well as this slow thinking comes under psychosis and syphilitic background. So that is also the main reason for her to have this symptom. So the memory retention is slow in the form of not with past events. She can be able to carry on all the past events, especially the bitter events, but the absent-mindedness is seen in memory retention in the present situation because of her slow thinking nature as well as overcrowding of thoughts even during sleep. She always prefers to, though she wants to live her life independently, but she always prefers the decision, she always prefers to get moral support from someone. So she always has the aversion of dread to be alone, because this is connected with the dependent nature as well as connected with her disease, because she doesn't know when she get panic attacks, when she get aura. Because of these continuous health issues, she was always having the sensation of overwhelming feeling of taking any responsibilities, even to be playing the role of a daughter-in-law, playing the role of a mother, playing the role of a wife. She feels always overwhelming. She prefers always to sit, she prefers always to sleep. She needs excess rest. Her past history: typhoid 2004, partial seasons 2010 started, dengue in 2015, COVID in 2020. Why I have mentioned these things is that already she is having psychosyphilitic background in the chronic stages of disease, which is seen in background of the infections also. All the infections such as typhoid, dengue, COVID comes under more syphilitic stage rather than psora or psychosis. So clearly we can be able to understand that the lady is predominantly having psychosyphilitic stage of miasm. Her family history: she is having one younger sister. She is very healthy. Father is healthy. Mother having thyroid. She has personal history of lactato. Since doesn't want to get another baby. She stopped with one child. So what could be the remedy? Anyone want to guess? This is a case report. See, mild fatty liver, bilateral non-obstructive renal calculus, left ovarian small endometriotic stick, intramural uterine fibroids in two places because of that her uterus itself retroverted, not antiverted. This is the second report. She is under treatment with me since 2 years. Now her report is only fatty liver as well as uterine fibroid, and the uterine fibroid one may have dissolved, only one is remaining, and the uterus becomes antiverted now. Anyone want to guess? Just try.
It's just a guesswork, doctor. I usually go with rheumatization and then choose one. So it could be lycopodium or staphysagria.
Anything? Any others want to try?
And seeing the miasmatic like it is psychosyphilitic, I would more go for staphysagria.
Okay, any try? Any guess? The remedy given by me is sepia. The indifference nature, suppression of the emotions. She wants to live her own life, but yet not ready to live her own life. Basically, as a human, if we take responsibilities only, we can able to live our independent life. Otherwise, it's highly impossible to live an independent life without taking responsibilities. So, this is the main reason, along with that chilly nature, slow in thinking, the laziness, overwhelming with the responsibilities, along with that, the symptoms of indifference to the own family members, especially showing her emotions only with the dad and her husband because they are very close to her, more supportive to her. That is the main reason. Along with that, there is a nauseating anorexia by seeing meat and non-veg. That is also the added reason for me to select for sepia. Till 0.1 I have given for almost 2 years sepia 30 ch. After that I repeated sepia 200 ch after 4 months. Sepia 1 gram I repeated after 5 months. So 0.1 I gave last month only. Out of 2 years I have given only 4 doses. That was single dose along with that only placebos. Here her follow-up symptoms. I think another case. Okay, her follow-up symptoms now is, along with the investigations report, she is not even getting single episode of aura or single episode of partial epilepsy. Her menses is very normal, no pain, no intermittent flow, no need to take rest. She started working, she started taking care by asking her to do all the mindful techniques. I have my clinic as holistic. The reason is that I train my patients not only with medicine, along with that I make them to take care of themselves, self-priority with doing intense journaling, affirmations, meditation, yoga, as well as taking the balanced diet. These things, the tiny differences in every woman makes a major difference among the family. So that is the main reason for me. Whatever could be the patient, not only with woman patient, whoever could be the patient, because we all know as a homeopath, all the diseases starts from mind. All the diseases are connected with the emotions. So once the patient understands the emotional impact, how they are getting disease, how they are getting sick, if they understand, there won't be no need of doctors in future. This is again interesting case. This case is again a most indifferent case and amenorrhea for 6 months, heaviness at the abdomen, the bloating sensation with recurrent tonsillitis from her childhood till the age of 31. Even there will be tonsillar deposits. The white deposits will be seen in tonsils. So, coming to our physical genders, the sleep is very normal. Her thermal nature is very hard. Even in winters, she prefers to use AC. Since she is rich, she is having centralized AC all over the home. I will tell you what is the reason for telling this particular thing. Because she is such a show of nature. Even with her show of nature, she teases everyone, including me, as well as her sister. Such a show of an arrogant lady. Castless, sweat only profuse on the armpit, no stains or no smell. The appetite, she is a foodie, can't tolerate hunger. She tries to eat. She is very taller. Though she is taller, her weight is almost around 80 plus and 90 plus. Her urine is normal. Her desires always regarding with fatty foods, all the chat items like eating burger, pizza, french fries, wedges, all the non-veg. Even daily she has a homemaker for her as a servant. With her help, she is always eat non-veg daily, regularly. The lunch should be with any type of non-veg. The stool always, because of continuous eating of fatty foods, because of continuous eating of non-veg, her stool is disturbed completely. She won't have any regular pattern, sometimes constipation, sometimes diarrhea. Her puberty age is 15 years. For example, if she was in 2016 or 17, if she was around 31 years, her puberty age is 15 means definitely it shows that her puberty is delayed. It's not regular. The 15 years when in that generation, might be she was early 80s or nearing 90s. So in that stage, definitely puberty around 15 is not earlier or not normal. It is delayed. Always she faces irregular cycle. This amenorrhea in 6 months is not only the problem, she always have the irregular cycle immediately after getting puberty. Very slow, 2 to 3 days. Sometimes she doesn't even need pads to be used for that flow. Sometimes spotting only will be there rather than flow. It will be very bright red, stinking and staining. She faces pains in lower extremities during menses, though the menses is very low and very scanty. Sometimes it is mixed with small threads. Her mind nature, as I already told you, she is a teasing nature, show of nature, jealousy, even with her sister. She was born with one sister and one brother. She is the last person in the family. She was such a pampered child. She never allowed to buy or give love by her parents to her own siblings. Such a jealousy nature. She always tries to keep her parents away from her siblings. She always tries to concentrate only upon her rather than giving importance to her siblings. She always compels each and everything, though she gets the best in her life. Even she was not interested to get married because the age difference between her and her husband is almost 10 years. So that is the major reason for her, for the aversion of marriage. And the second reason is that she felt that after marriage she can't enjoy the life. That is also the major reason for her not ready for getting married. But finally she accepted the marriage because that boy is very rich. This was Magnet in Chennai. That is the reason for her to choose marriage, though she is not ready mentally to get married. Unfortunately, her husband is not compatible. Dominant husband started ruling over her, which is completely, entirely the pattern of her life changed because she was such a pampered child. She likes to do whatever she is such a stubborn lady. After marriage, completely changed. Even if she wants to go out, even if she wants to eat something, she has to get the instruction from her husband. Such a dominant husband, because her dominant husband is not only dominant with her short-tempered with his short-tempered nature, he is very health conscious. He is conscious in maintaining the discipline and decorum in the family, which is missing with her. That is the main reason for her to feel more annoyed and more bullied. Because this is a basic thing. All the husbands will feel to the wife should be very compatible, the wife should be very obedient and disciplined. Similar, vice versa, the wife also expects the same from the husband. But she failed to do her regular responsibilities. Even she had separate servant for taking care of her children. She has 2 children. Even she didn't even feed her child with breastfeeding. Such a show of arrogant lady, she doesn't want to spoil her health in any form. That is the main reason. She always feels superior among others. She always comes to my clinic with her own sister. Whenever she comes to my clinic, she always tries to tease her with certain comparison. Like telling that I came here from Chennai with a costly car, she is coming through walk or coming through bike, like that. Always teasing and comparing. Even she tried to tease me in the form of, Doctor, you are telling that these how many years you are practicing, why you are having a simple clinic? Why you are not show up with your clinic? Why are you having a small clinic? Everyone will judge a book by its cover, not with the content given in the book. I told her simply, you have to be ready to read the book. Instead, don't judge by the book by its cover. Read the content, understand the knowledge, understand the essence what is given in the book, then you decide whether this clinic is worthy or not. Her past history, as I already told you, recurrent tonsillitis, childhood with chicken pox, family history, mother died in the early age. That is the main reason for the parents to do early marriage. That is the main reason. They didn't even give chances for her to select the bride. The reason is that because of she suffered with severe diabetes, suddenly to avoid the MI, they made married in earlier stage. Father hypertension, he was also my case only. This case, again her father is an interesting case, a recurrent calculus case. Why I want to mention here is that I sent to Dr. Mahila so that we can see the investigation report before and after regarding her father. I want to, though it is away from the topic, I want to mention the beauty of homeopathy, how it helps when you are selecting in constitutional simulum, because her father came to me around 72 years. I am the reason for her father to live till 87 years. Around 72 years in Chennai, Kaveri Hospital ruled out that your father can't live more than 10 days. Because of that, master health checkup ruled out that sudden mass, renal mass with necrosis and complete necrosis of the kidney as well as gangrene stage of the blood vessels surrounding the kidneys, especially the right side. Already he was an hypertensive as well as recurrent renal stone patient. Since his daughters are my patients, they took the reason for me to go for the spirometry test. Thankfully, even the necrosis kidney showed 5% urination function with a second kidney with almost 95%. With that, I chose him as a remedy. The reason is that he had only, I'll tell you only the totality of the symptoms with him. Then only you can understand how I selected that particular remedy. The thing is that he was a very dominant man, very adamant man. Since he worked in military, he always tries to beat his children even for silly things, irrespective of any environment, even among the street, among the home or among with anyone. Such an incident happened in his life. He beaten his own son among 10 members. This made his son to feel very much teased and annoyed. He gone away from the family without telling. Even till today, no one can able to find out where he is. So this guilty is the main reason for him to develop hypertension as well as recurrent renal stones. Where the recurrent renal stones were treated by using only the plant extracts. Especially in villages, they tell that one plant, no? Tupaku, I think, I don't know, to improve the kidney function. He was regularly drinking that particular thing. Other than that, he never went for, only for hypertension, he is continuously taking drugs. With these things, he felt that because he is having 2 daughters and only 1 son. He is also a moderately rich man. So considering this, who is there to take care of the property? So this guilt formation made him to ruin his life. Self-guilt made him to develop the disease patterns. So with that, he developed the physical symptoms of chilling, thirstness, insomnia because of always thinking about the son's escape from family, separation from the family. Along with that, he slowly, since he didn't treat it properly with his kidneys, he started developing these things. And again, he was worried about the diabetes of his elder daughter. Sister is diabetes, and this lady is with tonsillitis and uterus problem. So with that also, he was very much worried considering these symptoms. But one thing is that though he was worried about the separation of his son and worried about the health of his daughters, he never worried about his health. This is the characteristic symptom of that particular man. He always say, already 72 doctor, no need to worry about that. If God calls me, I'll go. No need to worry about that. No need to give treatment. That is a lonely statement told by him always. He is extreme chilly, he is extreme thirsty, he is very much positive other than his short-temperedness. He handles the life in a positive aspect. He never worried about financial crisis. He never worried about even when his wife is struggling with a disease. He didn't worry about that. He is ready to face whatever could be, because I asked him, your wife has struggled in such a way, why you didn't worry about that particular thing? He said simply, instead of suffering for a long time in the bed, better she can die. I can't able to see her suffering. That is a lovely statement told by him. So considering these things, he always loves to eat non-veg, as well as he is very diet conscious and health conscious. Only in the occasional times he prefers non-veg. He is an alcoholic, occasional smoker. His urine frequency will be very much intermittent, the flow will be very much intermittent and very much less because of prostate hypertrophy also. So after getting this problem, his urination is almost stopped. Once in a while, he can able to pass 1 or 2 drops. So considering these symptoms, I prescribe what could be the remedy? Any? No.
Sonika.
No, doctor. Arnica. Arnica 30 CH. I divided the dose I mixed one pill in 100 ml water. I asked him to take divided dose every 3 hours once for continuously for 20 days. Within 20 days, the renal mass completely subsided and the blood vessels started functioning. The obstruction of the flow stopped and the blood function started functioning properly. Almost the kidney recovered back. After continuous treatment, I think around 6 months to 8 months, he continued the treatment with me. I gave him till Arnica 1 That is the only prescription I given. After that, he was ruled out with no pathology of kidney other than hypertension, where he is taking allopathy already. I able to know before 6 months only he died around 87 years. He came to my clinic around 2015. So this is the beauty of homeopathy. Sorry for getting diverted and telling another case. So any case regarding this case?
Access of retina.
No, doctor. No. This is my reports. Before treatment, adenoid bulky uterus, prominent endometrium, and bilateral polycystic ovaries. Everything got subsided, liver as well as uterus comes to normal. Only the remaining symptom with ovary, that too not very much minimal. The right ovary and left ovary measurement has come almost 3.6 and 3.9. This case I gave Pulsatla 30, 200, 1 0/1, 0/2 and 0/3. Again, this is an acute case. Unfortunately, I can't be able to record this case. The reason is that I am not having investigation reports because that lady followed me only for 3 months. The main reason is that she had a worst life with her husband, the suspicious husband. Along with that, he had a huge problem with illegal affairs for her husband. That is the main reason for her. She was living her life as a nomad, living here and there because of fear towards her husband. So that's why this case I can't be able to show the chronic stage because she continued with me only 3 months. That's why I have showed only because this is adenomyosis case. That's why I have given only WhatsApp record because this case particularly she had the flow of almost 30 days before coming to me. The menses flow almost for 30 days. 30 days with clots. So this is the first stage after taking medicine. And the third day, only the membranes with too little and no clots, used only 1 pad. Within afternoon, she didn't even use pads. So within 3 days, her long-lasting flow of 30 days comes down. This is the case history. Age of 49 years, treated by me since 3 months. After starting my treatment, the cycle is very regular. The acute complaints since 3 days mixed with clots, membranes, especially working more, bearable pain in abdomen. Since she came to me only for a few terms, I didn't repeat the medicine or I didn't select the constitutional syndrome because after regulating the cycle, she was better for 3 months. After that, I don't know what happened to her and where she is living. whether she is living or not. So that's why I didn't give an constitutional stimulum. I gave only acute stimulum, considering the symptoms of insomnia for 1 day because of excess flow, thermal heart, thirsty, urine, stool, appetite normal since it is acute case, ailments from the anemia as she was continuously facing this problem. The mind is extremely irritable, anxiety in the flow, and the mentally restlessness, extreme weakness because of the anemia, weeping, dispersion. So the selected remedy is 30 ch per dose, but divided dose in water for 2 days, once in 4 hours, 2 teaspoons. Here I gave Ferrum Pass, 30 ch. The reason is that considering the only acute nature, the anemic nature, that is the main reason for me to choose Ferrum. And the pass, the reason is that lack of love and care. That is the core thing for me to select even in acute stages with acute stimulum. This made wonders. See the flower. The flow almost for 30 days. Completely stopped within 2 days. Before medication, 1 pack within 1 hour. After medication starting, first day 4 packs, second day 1 pack per day, third day no packs. So this is the beauty of homeopathy in selecting a stimulum. The dietary recommendations is a common theme for every woman, whether they are facing or having any problems, irrespective of any reason. If a woman is coming to you, please recommend diet and regimen, which is the main part to give the medicine, which do wonders along with homeopathic selection. Some of the diet recommendations like carbohydrates, healthy fats, fortified foods, folates, especially during pregnancy as well as breastfeeding period. Limit the processed foods. Stay hydrated. Ask them, especially whenever the ladies are facing lack of menstrual flow, ask them to hydrate their body either with electrolytes, water, and along with the fruit juices. These are the diet recommendations, especially leafy vegetables and vitamin D sources, because vitamin D is very important for the woman, especially during pregnancy and after pregnancy and during menopausal period, where 99% of the women faces vitamin D deficiency and calcium deficiency. So, if you are following the balanced diet regularly, even being a doctor, we also playing the role as a doctor, as a wife, as a mother. We have to take care of our health by taking these diets regularly. These are the regimen recommendations. Ask them to stop, regulate the pattern of meal, eating very less, minimizing the diet, avoiding the junk foods, concentrating on the balanced diets. Along with that, ask them to do stress management by doing affirmations and intense journaling. Affirmation is nothing but the regular course should be written from morning to night. Even if we are interested, we can notice the time of the thing when we are going to do, including whatever it be, like going to clinic, picking the kids, doing bank transactions, going to cook the food, going to somewhere, buying groceries, buying vegetables. These affirmations helps us to feel that the regular course are not hectic course. We feel much comfortable. Once we start writing that, we feel that only these courses are available from morning to night to be done. Otherwise, we feel overwhelmed. Overwhelming is the main core thing for any emotional disturbance, especially in the women. So, you have to be very careful in managing the stress. Along with that, the intense journaling in the night time, it means that daily, regularly after going to sleep, before going to bed, we have to sit in a quiet place, taking the paper and writing with a pen which affected a lost. What are the emotions impacted us? It can be connected with the recent emotions or it can be connected with past emotions. By writing this, you can understand where the problem is. Who is the reason for that particular emotion? What happened exactly? Because with our emotional disturbance, we might be the reason for that particular problem, or someone might be the reason for that particular problem. With the confused mind, we can't able to understand who could be the reason for the problem. So once you start writing, you can understand where the problem lies. So this helps you to get the clarity and to avoid the confusion of mind. So after writing it, just tear the paper and throw it. So that the same situation when it happen in your life, you won't react to that. You will be very refined. So the mental maturity will help you to overcome the stress patterns. So regularly doing affirmations, intense journaling and constant reading of any motivational books, at least 5 to 10 pages per day. So here whoever could be any gender or any age, concentrating on mental health is a core theme of handling our physical health. This is another interesting case and my heart-touching case. The baby of age 6 months. This is a baby of foreign case. The baby is from Europe, Poland. She communicated with me through online only. Since I am having website and blog, I am having foreign patients also. Here the comprehensive history of as the foreigners are more aware of investigations, she brought to me along with the investigation reports also. So, staphylococcus infection is ruled out. Along with that, she found out that vaginal candidiasis also. Bronchitis because of the staphylococcus, that baby faced irresistible dry cough, especially during night, which leads to vomiting. Disturbed sleep because of the cough. The baby faced sleep apnea also. This is a physical gender. Since the baby is 6 months old, I gave more importance to the physical gender of the mom because mom is the main reason for the interconnecting of emotions in the baby. What are could be the disease? The staphylococcus and candidiasis are the infections. The infection seen in the particular baby only because of the emotional impact of the mom. Because the baby doesn't know who she is. Then how the emotions impacts her. So considering the physical genders and mind symptoms of mom, clouding of thoughts, even her mom won't sleep properly, completely disturbed sleep. She is a worker. She is working in IT field. Baby restless within few hours, not only because of cough, even with a healthier period also, the baby will wake up in between without having deep sleep because of the emotional impact of the mom. The thermal for both baby and the mom is chilly. Thirst is excessive thirst. She always tries to drink. She always tries to hydrate her body by taking fluids, soups or any form. Such a dryness is seen. Here I am mentioning this that this is also a key factor for selecting a single one. Urine is normal for both mom and the baby. Appetite is normal. Mom has a craving of meat and juices, aversion to milk, both for the babies as well as the mom. The stool is normal, but both the baby and the mom faces whenever they are trying to take milk or doses. Bright red mixed with small threads, not staining. She was para to living to abortion 0. The past history of bacterial infections, bronchitis at the age of 23 years, even for her mom. The family history with mother hypothyroid, father healthy, and one sister. This is mom's maternal side. Mind of mother is very introvert, fastidious in alignment. She can't compromise with the alignment whenever the kids are doing messy. She needs perfect cleaning, nightmares, fear of dog, wants to be with company, brooding about the past bitter events, sensitive to the rudeness and criticism, authors don't get hurt much. She won't remain silent, frustrated in taking responsibility away as her husband is staying away from her as she was working somewhere. Her intellectual level is more highly intellectual, loves nature, lacks predominance, but not to keep in her. The reason is the cleanliness. She never likes the messiness or the smell of the dog or cat. Emotionally bonded, even with everything, especially whenever her babies are suffering with something, she became very worried and she will start crying. Considering these symptoms, selected remedy prevented CH only one dose, along with a continuous 4 months only with placebos. The follow-up, the baby started sleeping, no nightmare. Within 4 months, all the tests negative. Reason for selecting is children, desire milk, and orange disagrees, highly intellectual, nightmares, loves nature and animals, boredom with the children, but feels frustrated in taking care of kids alone, accepting the responsibilities, overwhelming. Considering this, any guess what could be the remedy? No. 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 Natron card 200. This is the report. Since it is from Poland, language is in Polish. This is Candida and the Staphylococcus. This is before treatment report. This is after treatment. Absent negative. Thank you all. Thank you again for ISMA Coimbatore chapter. Thank you everyone for sitting with patience to hear my thing. And also, thank you Dr. Vidyalakshmi ma'am to give the collaboration of homeopathy along with allopathy in endometriosis as well as handling all the female reproductive problems in women. Thank you very much.
Thank you, ma'am. Now we'll move on to the question and answer sessions. If anyone has any doubts, please raise your hands.